Chairman, Sunita, Madhu, most importantly, Harshad, Dr. Vishal, and the whole Homecare team. I'm so happy and delighted to be here. 10 years has gone very fast, but I must say that it's been a very meaningful 10 years. And to make a significant difference in people's lives in multiple ways. You know, sometimes in a hospital system, the nurse is part of a large system, the caregiver is part of a larger system, and there is this blanket of a high-end tertiary care center which you can always fall back on. And sometimes when you go into the home environment, you're not so close to this, into this big hospital system. So the responsibility on that caregiver is so much more. And sometimes we don't tend to realize it because patients' families expect that, and I think they deserve to get it. But here, they're looking after them in that environment, and for that, I must congratulate the entire team for doing it and doing it so well over the past 10 years. Most institutions come into being because there's a crying need in society to do something and to serve, and we will see that happening time and time again, that these institutions leave a lasting legacy behind. When we started Apollo Hospitals, when Chairman came back from really a very good and a strong practice in the US to come and serve his nation, because there was a need in society. When Apollo was started as a hospital enterprise, there was a need in society for that level and that quality of healthcare. When the pharmacy started, when digital started, when the clinic started, everything started because there was a need in that area. And this is a very specialized baby, maybe because it's only 10 years old, the way it is now, but that's because there is a huge need in society. And you heard from both Harshad, from Sunita, from Vishal when he spoke, that we really have to do this. And we do it because there is a responsibility from our side to do what we have to do consistently with the highest level of quality, the way Madhu said, zero harm, to just focus on outcomes, because I think that is the numbers which we're all looking at, that the outcomes have to be phenomenal. We have to make that difference. It is not just providing interventions for the patient, but to just be a holistic provider for them, and to me that is what is going to make a huge difference. So this is a promise in the 10th year that we will leave no stone unturned to see that the patients and their families have the whole Apollo ecosystem behind them, taking care of them. You have a display of everything which we offer from just this division. But imagine that this has the whole Apollo ecosystem behind it, and then we have a healthcare blanket, we have a healthcare sheet taking care of you, and that is the promise today.
Service. But it takes me back almost 50 years ago, when I came back from US. I was really saddened, but there was absolutely nothing available. And we were truly a third world healthcare service. So, being a doctor, when you see patients who could have been helped if their facilities were there, and it is not there and we lose them, it hurt me so badly. Especially in '79, I had a young man who was only 38-year-old with 2 children. When he was to go for surgery 2 years because there was no cardiac surgery in India, and so we couldn't go because you couldn't raise $50,000 to go to Houston for surgery, and that was when we saying, why shouldn't we have it here and give it to our people? What is needed is the human skills. These human skills purely, I have seen Indian engineers, Indian doctors, Indian technologists are equal in US. That 10 years which I spent, I don't think in Indian space, in an Indian doctor or Indian technologist was anything less. So I said, when we have this, what is needed? Then of course, what is needed in a hospital is a backup service. Unfortunately, the government of rules then was that for custom duty, we imported one of the equipment that we have to save the people at home. It was 320%. It's called a lottery. And Baba, the patient is suffering, he needs care, and we call it 320% duty. And then they could fund a hotel, they could fund probably a cigarette shop, but the funding was not available for hospital. But everything was in Delhi. I went many times to convince each of these people, but finally I am happy, whatever effort that I took. When Jnana Singh inaugurated our hospital in 1983, September 18th, that became a remarkable day for healthcare in the country. Because it's not just for Apollo. Apollo, yes, we have continued and done excellent in every single field of care. It started with cardiac, but we didn't stop there. On day one, we made a multi-specialized hospital. Today, the care that's given in Apollo Hospital and every single field of medicine is on par with the best centers anywhere in the world. I must speak to a cardiologist, and it started with cardiac surgery. In cardiac surgery, we have done 231,000 cardiac surgeries, and that's the highest number in the world. And in healthcare, it's not the numbers.